Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our COVID-19 news conference for the latest information on COVID-19 for the Amarillo community. Let me go ahead and quickly introduce who is on our panel today. We're joined by Casey Stoughton, City of Amarillo Public Health Director, Dr. Todd Bell, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Northwest Texas Hospital Chief Medical Officer, Dr. Michael Emmetier, BSA Chief Medical Officer, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We're going to go ahead and go to our panel for some quick opening statements, and then we'll take questions from our media members who are in attendance. Let's go ahead and start with Casey Stoughton. Casey, how are you today?
I'm good, Dave. Glad to be here this morning. It feels like we've been here before. So we're coming to you this morning, the week before Thanksgiving, kind of just like last year. So, this pandemic has certainly gone on for a long time. Our numbers aren't going in the right direction like we thought they would be. We're certainly seeing kind of an increase in numbers this week. So would love to visit with you about that this morning. We do hope that you have a safe and happy Thanksgiving next week. So certainly want to tell you that as we're moving into this second season of Thanksgiving during time of pandemic. This morning, we have our total numbers and our total count since the start of the pandemic in March of 2020. We've got 49,171 people who have had COVID-19 in Potter and Randall counties. We're currently at 22,465 active cases, and we have 925 deaths that are due to COVID-19 here in our community. The 5-day new case average is up to 159 new cases per day, and our GA34 hospitalization percentage is at 11.48%. We're not an area of high hospitalization as defined by the governor, but we are still in level red with 3 of the 4 metrics that are in level red. Our 7-day rolling positivity rate is currently at 10%. And the positivity rate at the drive-through testing site is at 42%. Our COVID testing is still available at the drive-through testing site. You can call 378-6300 to be screened and directed for testing. Vaccines are available at many locations around our community, including public health. We are now offering our COVID vaccines have moved again. It's kind of a mobile fixed location, but we moved next door to 1000 Martin Road. We have started the remodel of the public health annex building, and so our COVID vaccines are available in the main public health building at 1000 Martin Road. STD, TB, regular immunizations, again, all available by appointment at 378-6300. And our monoclonal antibody infusions are still available by appointment for both people who have been exposed and people who are positive, who fit that high risk criteria. And it's pretty robust criteria. So if you think you might qualify, or even if you're not sure, please call us and check, because we want to make sure that we're treating as many people as we can, so that our community is safe and healthy as we can be. If you don't have a doctor or you need a referral, you can call us at 378-6591, and that's directly into our call center. So you can even call that number on Saturdays, and you can call directly into our call center and be screened and referred into the monoclonal antibody infusion center if you don't have a doctor who can refer you. That's all I have today, Dave, and I'm happy to pass the mic on to our other panel members.
Thank you, Casey. Let's now go to Dr. Todd Bell, Public Health Authority. Dr. Bell, how are you?
Doing well, David. Thank you. So I think that our optimism about the numbers that were going down, it turns out, is kind of unfounded. Hopefully, this recent trend is a bump in the road and is not going to lead to a longer-term uptrend in transmission rates. But as Ms. Stoughton has said, we definitely have been seeing that the transmission rate has gone up in the past week. We're still waiting to see what the full effects of that is on hospital function and hospital pressure. Remember that the transmission rates are an early predictor of what we end up seeing later on as being admissions to the hospital. But there's new variables that are in play. We have the monoclonal antibody infusions, which are certainly are helpful and are more widely available than they were last year at this time. We have a significant portion of the population that has been vaccinated. That both decreases the risk of getting COVID, as well as significantly decreases the risk of ending up in the hospital. And frankly, we've had a lot of people that have been infected in the past few months, which also is going to decrease the risk of folks that are reinfected of ending up in the hospital. So we think that at least a portion of those folks who are testing positive now are folks who previously have had COVID and have been now reinfected, or are folks who have had the vaccine but have a breakthrough infection. And in both of those situations, we think that the infections are going to be milder than they otherwise would be. That does highlight the importance then of getting your vaccine. There was a recent study came out a little less than 2 weeks ago. I think it was at the end of October in a journal called MMWR. They looked at across 9 states. They looked at all the people that were admitted with a respiratory illness to the hospital. And out of the 7,000 or so patients that they had that were admitted with respiratory illness, they then divided them into which were the folks that ended up having COVID. And they compared the folks who had been previously vaccinated and had a breakthrough infection and ended up in the hospital to the folks who had been previously infected with COVID. In other words, those folks had natural immunity and then subsequently, more than 3 months later, were admitted to the hospital with COVID again. And what they found was that the vaccines were actually more effective. There's about a 5-fold lower risk of being hospitalized with COVID if you'd been vaccinated compared to if you'd been infected. So even those folks who have had prior infection are still going to have risk. Even folks that are vaccinated, the risk is not zero. But we know that the vaccinations are highly effective in preventing these hospitalizations. And we continue to encourage people to be vaccinated, even if they've had a prior infection and feel like they may have natural immunity. We have data to say that you can still get reinfected. With that, then, we're coming into the Thanksgiving holidays. As Ms. Stoughton had mentioned, I think it's worthwhile to highlight again the importance of things like trying to improve ventilation in homes, wearing masks when we're in groups of large people, and especially if it's a mixed group where some are vaccinated and some are not. That includes children. So if we have kiddos that are too young to be vaccinated, they can potentially still acquire and spread and transmit the virus. And the last thing that we want to do is to have a wonderful holiday gathering that subsequently is followed by a January funeral because we have a family member who caught the illness from what's meant to be and as important as a family gathering. So I would just encourage people to do the things that we've been saying for a long time: get vaccinated, wear your mask, wash your hands, take care of each other. And with that, I'll turn it back over to you, David.
Thanks, Dr. Bell. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Oh, good morning, Dave. Well, I have to admit, I'm a bit discouraged for all the reasons we've already heard. Is that 2 weeks ago, I thought we were going to cruise into the holidays, seeing a downward trend of this virus, that we'd all be in good shape. And over the last week, unfortunately, we've seen things very differently. So, they're saying it this morning. I heard that upwards of 14 states are now seeing significant increases in COVID positivity. We're still seeing about 1,000 deaths a day in this country from this virus. So, again, I think the take-home message is we're not out of the woods yet, and we all want to enjoy our holidays, as Dr. Bell said and Casey said. We're going to start gathering. I was hoping Dr. Bell would have some good explanation as to why we're seeing this bump, and I'm not sure there is. I don't know if this is a hangover from Halloween festivities, or is it because the cold weather's moving in and people are moving indoors, or we're just all letting our guard down. But I think take home message is, please, I think the greatest gift we could give our families during this holiday is to protect ourselves, get ourselves vaccinated, because certainly none of us want to be the turkey that infects everyone with a dangerous virus. So please take that in consideration as we all travel, because a lot of people will be going to some higher risk areas, including like New York City right now, which is showing a bump. Now, with regard to our numbers at Northwest Texas, so we are at 42 positives today. Now, a week and a half ago, we were at 28, and I was really hoping that would trend down. So we've seen this bump back into the 40s. Out of those 42, 8 are vaccinated. So that means, that basically about 34 of them are not vaccinated. Now, it's interesting that we have 16 patients in our critical care unit, our ICU, and 10 of those are on ventilators right now, requiring those. Out of those 16 in the ICU, 0 are vaccinated. So out of the 8 that we have that are vaccinated in the hospital, they're all doing well and are on the med surg force. So again, we continue to see that even though people may get the virus, having had the vaccine, they're not getting as sick or critically ill as we see those who have not received the vaccine yet. Those 42 patients we have, that's 8.5% of our licensed beds, but that's 18% of the patients we have in the hospital right now. So still a significant contribution to our total census in the hospital. Now, we talked about we're using 21 ventilators. 10 of those are being used for COVID patients right now. Our outpatient testing has been all over the place. Yesterday, we were at 9% positivity. But over the weekend, we got as high as 17% positivity rate in outpatient testing. So we are generally seeing a trend upwards again of people coming in with the virus. And we have had 8 people lose their lives since the beginning of November for this virus, which is tragic. So as Dr. Bell said, is the best way to prevent that is prevent people from getting the virus. At this point, we continue to have staffing challenges. We have 22 members of our staff right now quarantined because of either a high-risk exposure or having the virus. We will be losing all of our traveling nurses by the first week of December. So again, that continues to be a challenge as we lose employees for some time for the virus and as we lose these travelers. We've talked a lot about how many holds do we have in the emergency room. This morning we had 10 people holding the emergency room waiting for beds. We knew that there were 11 patients out in the region that were waiting to be transferred to a higher level of care. And we had gotten down to almost 0 in the regional hold. So again, I'm not happy with where the numbers are going, suggesting that we're kind of get back into a problem where we're seeing a small spike or hopefully just a bump, as Dr. Bell says. So take home message, please keep yourself safe during the holidays. Take every precaution you can. Make vaccines a priority. That's how you can really protect your loved ones and yourself from this virus. That's all I have for today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Good morning. Thank you for letting me be on the conference this morning. I share some of the concerns from our other physicians that have spoken thus far today. We have not been able to drop our census here in terms of COVID hospitalizations down below the low 30s, which is where we were back on November the 3rd. We had about 35 patients in the hospital at that time. We were talking about the testing rates declining in the month of October compared with September. And we were also optimistic that we were going to continue to see a downward slide. And obviously, that's not what's happening across our city and across the country. This morning here at BSA, we've had a significant uptick, and we're up to 56 patients hospitalized right now with COVID-19. Of those 56 that are hospitalized, 93% of those people in the hospital are not vaccinated. That number actually is higher, that percentage. We were hovering in that kind of 80 to 85% of our admitted patients were unvaccinated. Now it's 93% that are not vaccinated that we have in the hospital. 38 of those patients of the 56 are on our med surg unit, and 16 are in the ICU. We had a couple in the ER that were admitted from last night. And we had 8 new admissions yesterday for COVID-19, which is a significant uptick in our COVID-19 admissions in one day compared to where we've been running with those numbers. We have a total of 311 patients hospitalized today. So that's 18% of our hospital census is secondary to COVID-19 patients admitted for that reason. We're using 16 of our ventilators right now. Again, 8 of those are on COVID patients. We had 37 of our 48 ICU beds occupied this morning, and we had 20 of our intermediate ICU beds occupied. 6 of those 20 were ICU level of care patients. that we had in the intermediate care unit. Our testing numbers, as I mentioned, have been rising. We're up to 14.6% of all of our tests done in November month to date are coming back positive, and we finished October at 11%. So that's also a jump up here recently. And again, I think that our biggest concern is that we are approaching the winter months. I was just looking at our flu data this morning. We have essentially minimal flu cases at this time. We're seeing a few here and there, but nothing substantial. We are not in a quantifiable flu season, which means that to reach that threshold, we have to have 5% of our isolates at a minimum positive for influenza. We're not even close to that. So flu's coming almost certainly. The question is when, probably later in the fall or the winter, we'll see that. Maybe we'll get fortunate again and have a very mild flu season like we did last year if folks are continuing to mask and trying to appropriately social distance in certain situations and settings. But I can't emphasize enough that the data on the vaccine efficacy and safety is overwhelmingly positive. The best way to protect yourself, the best way to protect your relatives, especially around the holidays when you're congregating, is to get vaccinated. Time and again, we're seeing additional data come forth that shows that your risk of getting a severe infection, your risk of getting hospitalized, your risk of dying is less if you're vaccinated. It's not zero, but it's a level of risk that gets reduced substantially. Certainly if someone's immunosuppressed, if their immune system is not working optimally because of a disease state or because of a medication that they have to take, they're going to be at higher risk for a more severe infection. They're going to be at higher risk to not respond as well to the vaccines. It doesn't mean they shouldn't get them. They're the ones that most need the vaccines to try to give them a little bit more help in terms of fighting off an infection if they get COVID-19. So again, please do what you can to encourage your family and friends that are close to you to protect themselves, get vaccinated. Millions of people across the world have been vaccinated, and it's been shown that the vaccines are highly effective and very safe. Yes, there are some situations where folks have had an adverse reaction to a vaccine. Of course, no vaccine or treatment for any disease condition or state is ever without risk. There's got to be some risk to have it be also potentially efficacious. Otherwise, it's an inert substance we'd be giving you. I've said that time and again, I can't reiterate it enough. No therapeutic intervention comes with zero risk. However, the vaccines have been shown to have extremely low risk when you look at the studies and the data supporting their use and their efficacy. So again, be smart, be careful, protect yourself. We will continue to do our job here to take care of you and your family members. If you require hospitalization, that is our job, that is our duty. We want to make sure we have good outcomes. We're very hopeful that some of the new oral drugs that may be coming out for treatment of COVID-19, if you're infected, may help us keep people out of the hospital. We're waiting on some of that FDA approval to come through. But again, we're still not there yet and not ready to have those drugs available to us. They do not supplant vaccines. They would be used similar to the monoclonal antibodies or analogous to how we use a drug like Tamiflu for influenza, where they would reduce the severity of disease, it appears, from those early studies. But again, the best prevention is vaccination. And that's all I have today. Thank you.
Thank you, Dr. Lementier. Let's now go to Dr. Roddy Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Thank you, David. I'm doing well. So first, I'll just go to our numbers. Right now, we have 6 COVID patients in our hospital, one of which is in our ICU. As with every panelist here, I want to highly encourage everyone to consider getting vaccinated if you are not already vaccinated. If you've been on the fence, please talk to your provider, have discussions as to whether it's right for you. But for my family, myself, it's right for us. And I really encourage that every veteran get vaccinated. We are offering the booster vaccination for both Moderna and Johnson & Johnson here at the Amarillo VA. Just as a point is, For the Moderna, it has to be 6 months after that second dose, and for the Johnson & Johnson, it's 2 months after the single dose for the boosters. So for veterans that are eligible for that, or their spouses or caregivers, we do offer it here at the Amarillo VA, and so would highly encourage you to come in and get it. If you're not certain if it's time for you, please call, talk to your provider, and we can look it up and let you know if it's time. Do want to remind our veterans that tomorrow we'll have a telephone town hall at 6 o'clock. If you don't get a phone call, or if you get disconnected or prefer, it is also offered on Facebook Live via our Facebook page, so I would encourage you. Last thing I want to say is I want to thank the many organizations and businesses across Amarillo who had events or did things to recognize veterans last week in honor of Veterans Day. I know many places may have offered free meals, free haircuts, special discounts, and all sorts of other things. And I just want to thank you for taking the time to recognize our nation's heroes and our veterans. We had our Welcome Home event here on November 6th. Got to see over 700 veterans come through, provided some meals, thanks to United, many other things. But the other thing that was really great is about 120 of those veterans stopped by to get a COVID booster during that time. And so, and we also had influenza vaccinations going on during that. So once again, encourage everyone to get your vaccination. As everyone mentioned, we've got the holidays coming up. Please look at how are you going to celebrate those holidays with family, friends, but being safe. And so with that, I want to thank the city of Amarillo for this opportunity, and have a great day.
Thank you, Dr. Gonzalez. Let's now go to members of our media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with Morgan Durden of KVII Channel 7. Morgan, how are you?
I'm good, David. How are you?
Good, thank you.
My first question is for Casey. The city has been hosting various mobile vaccination clinics around town. I was wondering if this has helped increase vaccination rates and what the turnout is like at these various sites.
It's helpful. I think every opportunity is important. Every time that we're, in an area or in a community or in a business or, in a space, then that is another opportunity for somebody to be vaccinated. Each individual clinic has its own turnout, and so that is we have just kind of a different. They're all different, and so they've been good. Usually, it's a space that we're invited to, and so folks know we're coming, and they advertise, and so we have had successful events.
Great, thank you. And regarding the monoclonal antibody infusion center, I know that previously the data was about 200 patients a day. I was wondering if that was around a similar amount, and if this treatment has still been limiting how many of these patients end up in the hospital.
So that is our total capacity. So we can see up to that number. We are seeing anywhere from, we can see anywhere from we're averaging anywhere from 20 to 60 patients a day. Yesterday, we saw just over 100. And so we've seen a total of about 1,400 patients since the start in September. So it's certainly seen a lot of patients. And yes, the goal of that medication is to help stop, the progression to severe disease and prevent hospitalization.
Thank you. That's all I had.
Thank you, Morgan. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you?
Pretty good. How are you?
Good, thanks.
First question is, do we have a number of how many kids 5 to 11 have received their vaccination through Amarillo Public Health?
I don't, Aaron, but I can get that number for you.
Alrighty, thank you. And with the expected expansion of boosters to all adults, are we prepared for that number of people to come in and get a booster?
Yes, if that approval comes, then we're thrilled if people are vaccinated. So I think we certainly have that capacity. They can't all come in one day, but as long as everybody kind of spreads it out a little, then we can certainly provide those boosters. And I think it's important that folks also who haven't had their first or even their second dose also come along with their friends who need their booster dose.
All righty. And with the upcoming dates on the federal vaccine mandates, are we seeing an increase in people coming to get those vaccines right now?
People don't normally tell us why they're being vaccinated, other than sometimes people will say, there's a new baby in the family. And, so unless, sometimes people are really excited about the vaccine and then they'll share those stories with us. But, we have, we have seen an increase in the vaccination clinic, especially with the kids being eligible. We've seen lots of kids, especially around that 4 o'clock hour, kind of after school. Lots of families are coming. So we haven't. People don't typically share their stories with us.
All righty. And are either of the hospitals requiring vaccines at this time?
I can speak up first. We have had the vaccination offering be a voluntary process up to this point. We have issued communication to our employees, our medical staff members this week that we must be in compliance with the federal mandate. So we're taking steps to make sure that we are in compliance, and hopefully this will encourage more individuals to get vaccinated or provide a viable exemption.
Aaron, same thing at Northwest, just, to be clear, you've heard about a lot of businesses undergoing the OSHA mandate, saying if you're a business of more than 100 employees, you have to have vaccines or be tested weekly. The hospitals here, we are under the CMS mandate. That's the Centers for Medicare and Medicaid. And they have not given us an option. They're saying that our employees must be vaccinated or have filed for a legitimate exemption. So we're in the same boat. We are at Northwest is complying with the CMS mandate.
And then for the VA, we continue to follow the presidential executive order and the VA vaccination requirements, just very similar to what the other facilities are doing.
All righty. And with those dates coming up, could this pose or cause any staffing issues for the hospitals?
And I would say that is always a possibility. We're doing our best to comply with the mandate and at the same time accommodate our employees. But yes, I mean, there's always that chance that some people would choose, to move on to another job if they don't think we can accommodate them appropriately.
I would say the same thing at BSA. We must be compliant with the federal CMS mandate. We have a large percentage of our patients that are Medicare patients. Obviously, we need to be compliant with the conditions of participation, which we always have been and need to continue to do so. Again, we're always worried about anything that would jeopardize staffing. We think that the process that is available now to provide vaccination clinics for staff who have not yet become vaccinated is our responsibility, and also the ability to properly lay out the exemption process for those individuals who have a sincerely held religious belief against vaccination or a medical exemption. So certainly those are going to be viable ways to not be vaccinated and be compliant with the mandate.
Yeah, and for the VA, I think anytime there's something that goes on, we're always concerned, will it cause us to lose employees? We have great employees here that are honored to take care of our nation's heroes and our veterans, but same thing when COVID started started, we were worried, was that going to cause employees to leave? And so, just like anything, it's something we work through, and we do our best to keep every of our honored employees here.
All righty, and one last question. Do y'all happen to have percentages of how many staff have been vaccinated?
And I would just say that right now, we had a number of vaccinated, or a number of our employees we vaccinated ourselves. We've had a bunch of employees that got vaccinated at outside facilities. So we're in the process of gathering all of that verification. So I can't give you an exact number, but overall, we're pleased to see a lot of our employees turning in vaccine cards that we got at other facilities.
Similarly, the majority of our employees are vaccinated. We are going to be retallying, obviously, those numbers as things get closer to the deadline for the mandate, and as we're offering more vaccine clinics. We have had a rise in the percentage of employees that are vaccinated over the past month, which is good news. But we still have opportunity for the remaining staff who are not yet vaccinated and who have not yet submitted an exemption. But that communication just went out this week, so we expect to see a lot of feedback there from our staff.
Yeah, from the VA, I mean, as with everyone, we do see increasing numbers, but I would say for any specific numbers, I would ask that you just reach out to our PAO team, because that'll have to come from the senior VA Public Affairs office.
All righty, that has me covered. Thank you very much.
Thank you, Aaron. Let's now go to News Channel 10. If I'm not mistaken, this is Kevin Welch, KFDA News Channel 10. Kevin, how are you?
I'm good, Dave. Thank you. Say, doctors, is there any special practices that you have to follow to dispose of medical waste or linens, things like that from COVID cases?
So and this may be a question better answered by the hospitals. The hospitals, of course, have a process in place that they use with all infectious waste. This is a virus that, frankly, is no different than many other viruses. It's bearing in mind that it does have to somehow get to your mouth, your lungs, your nose, your eyes. It's got to get to a mucous membrane before it can actually infect. It's not something that goes across the skin. That being said, what we call universal precautions are followed in part of that biohazard waste management, which is that obviously people wear gloves and things like that in order to avoid coming into contact with potentially infectious material. But again, COVID, it's not a super virus from the standpoint of how it's able to be or how it needs to be killed or handled. It is something that's just really, really easily transmissible. And so if it's in the air, if it's being breathed or coughed or aerosolized or in a droplet. So again, I think that the hospitals are probably using their standard bioinfectious waste processing, and that's perfectly adequate for getting rid of the virus on those things like bed linens and things like that.
Yeah, again, I would support exactly what Dr. Bell said. Is we've really learned that it's pretty rare for someone to catch this virus from contact on surfaces. So really, our emphasis has been much more the air ventilation and making sure that any room, that the air is turned over a number of times before another patient might be put in that room. And then we just follow what is our standard biohazard precautions, which we deal with a lot of very scary infections. And then this is just, one more that we follow the same rules for.
Yeah, the only thing I wanted to just add is, one thing is while we follow the standard thing for other things, realize the quantity, the number that we are doing. It just gives us another time to give a great shout out to our environmental management team, the housekeepers, the linen team. What a great job they do, because while they are always busy, and I don't want to pretend they're not, they've had to do extra work because of the number of cases we are seeing in the hospitals. And so I appreciate this question, because it's time to give a shout out to those that take care of our linen, take care of our housekeeping, make sure we are operating in a clean environment.
Okay, thank you. DSHS is reporting an average of about 5 available staffed ICU beds at Northwest and BSA. I don't know if that's accurate or not, but is the amount of ICU bed usage right now sustainable, especially since we're losing the traveling nurses?
I would say that we are very concerned about staffing. We have the RAC nurses that are being dwindled down, for lack of a better phrase, throughout this month because those resources need to be pulled back for the reasons that we know, which is they need to be working elsewhere for places that have higher needs. We personally at BSA are contracting with over 100 contract nurses that we've hired. And certainly without that contingent force of nurses and additional support staff like respiratory therapists, we would be not able to run our hospital. So it's critical that we continue to contract with those travel nurses that we are hiring independently. This issue is going on across the entire country. As we all know, it's been since the outset of the pandemic. We're going to continue to do what we need to do to try to retain our nursing staff and try to make sure that we have enough nursing to manage the patients that we have. I am concerned that if we have some more significant surge in our COVID numbers, that yes, this is going to be a problem, especially because of the ICU capacity that we have in the city between all 3 of our hospitals for the physicians on this call, and really what our ability to handle these patients is going to be. I looked back in my log book that I keep on our COVID numbers, and it was exactly a year ago today. It was November 17th of 2020. We had 200 COVID patients in the hospital at BSA, and now we're at 56. And we had a tremendous amount of additional nursing support staff to be able to manage those 200 nurses on top of our core nurses who were working tirelessly throughout that part of the pandemic. I hope to God that we don't go back to that type of number of COVID patients. If we do, I'm sure we're going to have our partners at the state helping us with staffing if that were to happen, because they've always stepped up to help us. But that's always a concern of ours, I believe.
Yeah, I would just say one variable at Northwest we can never predict is trauma patients, because we take a lot of trauma patients. A lot of those go to the critical care, and like for this last week, we've had a very busy trauma week between bad car accidents and gunshots. And even though we don't put trauma patients or surgical patients in the same critical care unit as COVID patients, we do have to cross-share staff sometimes. So as we've all talked about, sometimes these COVID patients will affect non-COVID patients in terms of the care they can receive because of the stress on the staff numbers. So yes, I agree with Dr. Lamentier and Dr. Gonzalez. We are always concerned about our staffing capabilities, particularly if we see an increased surge.
And I guess, Dr. Bell, do you think that we've entered an era in which we'll always have COVID infections here locally?
Yes. And I found a little bit so we've COVID at this point is widespread enough that there is no mechanism to be able to get it out of the system entirely. And immunity to COVID after infection, or even immunity to COVID after vaccination, is not 100%. And and that immunity tends to wane over time. What I think that we will probably see is that over the course of whether it's this year or next year, that we'll see surges, probably in the winter, of cases with a small, relatively small effect on the hospital numbers, because the majority of people are either going to be vaccinated or they've been infected before. And and then it's going to be something then that just gets built into that usual pantheon of wintertime viruses that we all have to deal with. But there's really no scenario at this point that COVID would get out of the human ecosystem. And even beyond that, we see now that there's spread within deer populations. There's spread. There's been cases of cats and other felines as potential vectors are being able to get infected. So there's just really not a mechanism now. It will be with us for the foreseeable future.
Okay, that's everything today. Thank you all.
Thank you, Kevin. Let's now go to Michael Cavello of the Amarillo Globe News. Michael, how are you?
I'm doing very good. Thank you very much. Can you hear me fine?
Yeah, we got you.
Okay. I have a new mic set up, so I wasn't sure. It seems like everyone's somewhat surprised by the rise in cases. Do you think this is a level of complacency because, a lot of the masks are not being worn in public? And I would say more than anything else, the masks not being worn like they was maybe 3 to 4 months ago. Do you think that's one of the biggest factors?
Yeah, Michael, I think that it's going to have to be some speculation, right? We don't have data. We don't do surveys. We don't have anybody standing outside grocery stores with a clipboard noting how many people are wearing masks. So this is all kind of speculation, but I imagine it's a combination of things. One of them is that there do seem to be very few people that wear masks. That may be because people are just tired of COVID. I get that. I totally get that. But COVID is not tired of us, right? It may be that we're seeing sort of the full effect of the fact that we're in that wintertime, school time season, that we have lots of indoor things that are happening. That's one of the reasons that we've all been talking about the holiday gatherings. Part of it definitely has to do with just the transmissibility of Delta and the fact that Delta is able to affect kids, because we've seen that our child infection rate has significantly gone up with Delta compared to with earlier versions of the virus. And then once a child who, again, may even be too young to be vaccinated, if they're in the a home with other folks, as obviously they are, then that constant opportunity for transmission that occurs within a household increases the risk of other family members getting COVID as well. So it's probably a combination of things. Again, the things that we can control, we can't control the weather. We can't control really how transmissible Delta is. What we can control are things like, do I wear a mask when I'm in a crowded public space? Am I vaccinated? Those are things that are under my control. And so I think that as individuals in our community, we need to find ways to be able to control those things we can to be able to contribute to the overall dampening of the spread of the disease.
And what makes COVID so different with the way we've produced the vaccine? I mean, because the vaccine does reduce the possibility of getting it, but it seems like the vaccine most important trait is that it reduces the chance of you having a hard reaction to COVID. So what makes COVID different than maybe other vaccines? I'm just trying to get this so people maybe understand that a little bit better.
So first of all, Michael, you just nailed the key thing. So COVID, the vaccine decreases the risk of COVID, getting COVID at all, but it significantly decreases the risk of ending up in the hospital or the ICU. So you've just nailed that. And again, kudos to you for making that differentiation. As far as what's different about COVID, I would say the short answer is nothing really. We see the same thing with the flu shot. So the flu shot will decrease the risk of transmission, but even more so, it decreases the risk of ending up in the hospital or dying with the flu. Folks who get the flu shot and have subsequent what would be a breakthrough infection, they actually have milder disease than folks who didn't get the flu shot. So we actually see that it's the same. We see the same thing with chickenpox. Someone who has a chickenpox vaccine, you can still get a chickenpox infection later, but the infection is going to be milder. As a matter of fact, we have a post-vaccination chickenpox kind of description or case history that's different than a wild-type chickenpox infection in someone who's unvaccinated. So this is just kind of one of those realities of the biology, that the bulk of our immune response is when something becomes an invasive disease. So diseases that are mild, that are going to just affect the lining of the nose or the mouth, those are going to be things that the body doesn't tend to mount as good of immune responses to. Now, there's some work being done on, and this would be great if it ever comes to fruition, on a type of vaccine that's really going to highlight the lining of the nose, for example. You think about back several years ago when we were still able to utilize something called flu mist, which was a flu vaccine that you sprayed in your nose. There was some evidence that that was better at being able to decrease the risk of getting any infection than the standard vaccine. And there may be something like that in the future for COVID as well. But this is really just what we see with really any vaccine that we get.
And this may be a little too soon to ask this question because I just heard about this. But has anybody got any impression of like the antidepressants that are being shown to be somewhat effective in like having really bad reactions to COVID, like fluoxetine, I believe is how you pronounce it?
So Michael, I think what you're referring to is there's a medication called fluvoxamine. That's Fluvoxamine, I believe. And it is similar to fluoxetine. It's a different chemical. There was a study that was actually it was a multi-part study. They called this an adaptive platform study. But basically what happened was they had a placebo group that was their comparator group, so that their control group. And then they had an arm that was fluvoxamine. And interestingly, they also had an arm that was ivermectin. Now, the ivermectin arm actually got stopped early because it didn't show any benefit. The fluvoxamine group, though, actually showed a reduction in hospitalizations in folks who started on the fluvoxamine. I want to say it was within 5 or 7 days of onset of symptoms. I can't remember exactly. But with that then, compared to the placebo group. So we don't know exactly why that is. Fluvoxamine is certainly not an antiviral, but it did show this reduction in symptoms. Now, fluvoxamine is like $6. You go to the pharmacy, and if you have a prescription, then your doc can get that prescription to you, and you can get it and take the medicine. That's only one study. Now, there were a few other studies. There's been 2, I believe, prior studies that were also randomized controlled trials. But but there's not enough data for that to be kind of a blanket recommendation that everybody should get that medicine. But certainly, if someone is wanting to do something to treat COVID once they've gotten it, and if for whatever reason they weren't able or willing or didn't qualify to get an infusion, then they could for the monoclonal antibodies, they could certainly look at talking with their doctor about fluvoxamine. And then fluoxetine is a similar compound that's in the same drug class. But again, we don't have the same data for fluoxetine.
And just kind of a rebuttal on that, not a rebuttal, but re-asking. Are we learning new things? And I'm pretty sure the answer is yes. Are we learning new things about COVID from some of the effects that, like, this is a serotonin uptake inhibitor. So are we figuring out new things about COVID by some of the things that are having positive outcomes for patients like this?
Yeah, it's one of the fascinating things. Of course, science is always a process. It's not an event, right? You don't go do science and then you're done. This has been a global, real-time, honestly, experiment. The human species has never been exposed to COVID before. Now we have lots and lots of people that are exposed to or that have had COVID. And there's lots of opportunities then for us to be able to learn from what's going on around us. So I think that the first step in any scientific discovery is just the powers of observation. Now that has to be followed though by a systematic method of being able to prove whether those observations actually are because of a cause and effect type phenomenon. So there's things that I can observe. If I saw a cat in a tree and then a few minutes later I get hit by a chicken truck crossing culture, then that's going to be something that I may have observed one event and then another event happened, but that doesn't mean that one caused the other. So we have to be able to take those observations and apply scientific rigor to those in order to be able to prove what is truly connected and what is not. But yeah, I mean, this is something that the science expands on a daily basis with COVID.
Thank you very much for your time, doctors.
Thank you, Michael. That concludes our Quiz Concern Media today. It also concludes our news conference for today. I want to thank all of our panel members who took the time to join us to provide this COVID-19 information to the Amarillo community. We'll see everyone next time. This is David Henry from the Communications